Hello, Dr. Deborah Green here, and it's time for 10 amazing cases of mind over matter. The mind truly is a force to be reckoned with. It can harm or it can heal. It can determine your reality and override physical influences. It's been shown that you can use your mind to reverse aging, dramatically reduce pain, heal arthritis and cancer, do better on tests, stop medication from working, and dry your sheets. What? Yes. It's only a question of time before the old structures give way and the new mind as medicine takes its rightful place. There are hundreds of studies showing the positive effects of meditation, but this one is especially juicy. It involves meditation and burning people, but only a little. Subjects received a mild burn on the back of the leg, 120-degree heat applied to their calves. Then they were given a 20-minute crash course on meditation over 4 days, 20 minutes a day for 80 minutes total. Then they were brought back into the lab, asked to meditate, and burned again. After meditating, the subjects rated the same pain 57% less unpleasant and 40% less intense than the first time. Brain scans were done during the experiment, and they showed multiple brain mechanisms for pain relief, including reduction in the actual sensation of pain, not just perception of it. As the lead researcher said, meditation retunes the brain. By the way, this reduction in pain is substantially greater than similar studies using morphine, hypnosis, placebo pills, and potent pain-killing drugs. Meditation could be the new prescription for those with pain. In the next experiment, a computer-generated mind trick cut arthritis pain in half. It goes like this. A person with arthritis of the hand inserts their hand into a small box with a camera mounted inside. A clinician gently pulls and pushes the person's fingers while a computer-generated image shows the person's fingers growing substantially longer and shorter, as if the fingers have become like elastic. This is only an illusion, but by watching the image while the fingers are palpated, the person's pain is relieved. And this worked for 85% of the arthritis patients who tried it. Oh, and here's another one of my favorites. An elderly group of men in their 70s and 80s spent a week at a retreat center outside of Boston. They lived in a time warp where everything was from the 1950s. The TV shows, music, the food, the furnishings and appliances, everything. They were asked to speak of the past in the present tense and to look after themselves as if they were young again. Before and after the getaway, various measurements were taken, and after the retreat, the men had improved across the board. Their gait, dexterity, arthritis, speed of movement, cognitive abilities, and their memory were all measurably improved. Their blood pressure dropped, and even more surprisingly, their eyesight and hearing even got better. How about creating nursing homes like this? Along these lines, there's the case of the Princeton University students who threw a non-alcoholic keg party, but they didn't tell their classmates the kegs were filled with non-alcoholic beer. It's almost impossible to get drunk on non-alcoholic beer, but partygoers proceeded to act silly, to slur their speech, and pass out on the ground. The students believed they were drinking standard beer, and that mindset dramatically altered their behavior. Here's an interesting one that has to do with how we talk to ourselves. Healthy people were asked to read pain-related words while imagining situations that corresponded to those words. Through brain scans, researchers found that reading the pain-related words activated all the areas of the pain matrix, the areas of the brain that light up when we actually experience pain. But when participants read negative words that were not directly associated with pain, words like horrible and terrifying, the pain matrix was not activated. In other words, be careful how you talk to yourself. Oh, and here's another one where subjects' legs were burned, and they were asked to report the level of pain on a scale from 1 to 100. They were also attached to an IV drip, so drugs could be administered secretly. The initial average pain rating from the burning was 66. Then volunteers were given a potent painkiller without knowing it through the IV, and the pain score went down to 55. Then they were told about the painkiller, and the score dropped to 39. Then, without changing the dose, they were told the painkiller had been removed and to expect pain, and the score shot up to 64. So even though they were still being given the drug, they were reporting the same level of pain as when they were getting no drugs at all. This experiment really illustrates the power of words and the power of the mind. I'm thinking especially about how doctors tend to tell patients that a shot is going to hurt or that they have only 6 months to live, things like that. We need to be very careful about how we talk to ourselves and to each other. Research shows that top performers learn at the same rate as those with lower levels of achievement. It turns out the ultimate determinant is how you view your mind. If you believe your mind is genetically determined, called a fixed mindset, it changes very little and your accomplishments will be limited. But if you believe your mind is adaptable, called a growth mindset, you can change your brain and accomplish many things, including improving test scores. The actual anatomy of your brain changes depending on how you see it. Here's another example. Meditation causes the brain to physically change in ways previously thought to be impossible. The brain is organized into two networks, extrinsic and intrinsic. These networks are rarely active at the same time, except in those who are experienced meditators. Meditation breaks down the internal-external barriers in the brain and evokes the experience of oneness. And then there's Jack Schwartz, a Dutch Jewish writer who was in a Nazi concentration camp where he was beaten, starved, and tortured. To transcend the pain, he began to practice meditation and prayer. After his release, he continued his practice and would demonstrate his skills of mind over matter by putting a long, thick sailmaker's needle through his arm without injury. He could also regulate his blood flow by causing the puncture wound on his arm to bleed and stop bleeding at his command. Testing at the Menninger Foundation found that his brain had different electrical activity compared to other test subjects. David Seidler, who won an Academy Award as a screenwriter for The King's Speech, had been battling bladder cancer for years, but the cancer kept progressing to the point that he had to have surgery. He decided to try visualization and spent 2 weeks leading up to his scheduled surgery visualizing a clean, cream-colored, healthy bladder. When he went in for his pre-surgery biopsy, they couldn't find any cancer. The doctor even sent the biopsy to 4 different labs for testing, all with the same results: no more cancer. Tibetan monks and Indian yogis are adept at manipulating their physiological processes while in deep meditation. In one of the most notable studies, monks were cloaked in cold, wet sheets and placed in a 40-degree room. The average person would suffer hypothermia in these conditions and could even die, but the monks were able to stay comfortable and to generate enough body heat that within minutes researchers noticed steam rising from their sheets, and within an hour the sheets were completely dry. I had the honor of traveling to Tibet and remember hearing stories about how new monks would hold competitions with each other to see who could dry the most sheets in the shortest amount of time. How about substituting that for a clothes dryer? Just kidding. Thank you for joining me for 10 amazing cases of mind over matter.